المشكلة إنه ما قاعد يصير full screen. طيب, so today we are going to take ما قاعد يصير عندكم full screen؟
لا دكتورة.
ما فيها دقيقة بس. I will just make sure إنه slides is moving. طيب, so clear, the screen is clear.
أي واضح
للأسف
دكتور.
واضح ها, لأنه
أيوة.
ما قاعد يصير full screen. Okay, so we'll go with this. Okay, so we're going to take ovarian and tumors, and we are going to have vulvar tumors. Okay, regarding ovarian tumors, as we said before, the ovarian tumors are not that common like uterine tumors and cervical changes. لكن the importance of the ovarian tumor is that once it's there, the manifestation is already late, and the prognosis will be poorer in patients with ovarian cancers. So this one we have to keep in mind. Okay, so today we are going to take the differential diagnosis of ovarian mass. We are going to mention the classification of ovarian neoplasm. We are going to compare between the functional ovarian cyst, benign ovarian cyst, borderline ovarian cyst, malignant tumors in terms of etiology, risk factor, cell type, and the origin of the tumor. We are going to discuss also the differential diagnosis of ovarian mass. We are going to classify ovarian neoplasm. We are going to compare between sorry, the other slide. Yeah, so we are going to compare between the ovarian tumors according to as we said, the characteristics, the etiology, and the clinical features. We are going to have a list of diagnostic investigations and the management of each case or each situation, and we are going to describe the staging of the primary ovarian carcinoma. Okay, so this is the objectives of this lecture today. Okay, so begin with, we have to know what are the normal size of ovaries. Is it palpable or non-palpable? Ovarian masses or ovaries, the normal ovary. Is it palpable or not?
Normally, no.
No, good. So normally we cannot palpate the ovaries. حتى على very lean patient, it's very difficult to palpate. Okay, you may find a tip of the ovaries in a very lean patient. Otherwise, it's not palpable. Okay. So, what is the size of ovaries usually? طبعا it differs according to the age of the patient. In the pre-menarchal, it's different. In the reproductive age, it's different. In postmenopausal woman, it's different. Okay, so most of the times in the pre-menarchal and the postmenopause, تقريبا the size is very, very small. Okay. In the reproductive age, it will be تقريبا 4 centimeter by 5 centimeter تقريبا. طيب, so in the perimenopause, طبعا it is divided into in the premenopause, the size will reach about 3.5 to 2 centimeter. In the early menopause, اللي هي إذا كانت the first 2 years of menopause, it will be 2 by 1.5 centimeter. And in the late menopause, it will be streak of ovary or very, very small or tiny ovaries. It will be about 1.5 to 0.5 or 0.7 centimeter. Okay, this is very important to know so that you know what is the size of the normal ovary and how to differentiate between the enlarged ovary and between the ovarian cyst. Okay, So according to the characteristic, we have 3 or 4 actually characteristic of ovarian cyst. Okay. So the first entity, we are going to take the functional ovarian cyst, then benign ovarian cyst, then borderline and malignant ovarian tumors. Okay, so if I say that there is a functional ovarian cyst or benign or malignant or borderline, this slide is very important to know because it will show what is the origin of each ovarian tumor. Okay, most of the ovarian tumor arises from the surface epithelium, which is known as serous epithelium, or mucinous, which is known as goblet cell. وين تلاقوا كمان goblet cell? Where can you find a goblet cell? Can you hear me?
ايوه دكتورة الصوت واضح.
Yes. So serous cells are there in the lining of the ovary. Okay. Mucinous cell, which is known as goblet cells. طيب وين تلاقوا goblet cell؟ في مكان آخر في الجسم وين؟ في GI. So GI, there is goblet cells. So why I'm telling you this? Because there is a correlation between the mucinous adenocarcinoma or mucinous adenoma with GI system. Okay, we'll come to that. Then we have endometrioid, and then we have clear cell and transitional cell, which is under the surface epithelium stromal category. Okay, the other cell line in the ovary is germ cells. Germ cells يعني زي مثلا تفكروا بحاجات related to pregnancy, like مثلا yolk sac, like embryonal carcinoma, like choriocarcinoma, like teratomas, like dysgerminomas. Among these, dysgerminoma is the most commonest, and the surface epithelium, the most commonest is serous cell adenoma or adenocarcinoma. Okay. The other cell type, which is known as sex cord tumor or sex cord stromal, which is arising with, the hormonal effect. This kind of tumor, it has hormonal effect, like, it can cause hirsutism, it can cause coarseness of the voice, masculinization, and hair loss. It is the symptoms of sex cord stromal cells because it is related to hormones, like granulosa cell tumor, like sarcoma, like Sertoli cell, like fibroma, like Sertoli leading cells. Okay, the voice is clear?
ايوه دكتورة.
Okay, ممتاز. So it's clear, right? The three cell lines is very important to know, because each tumor, it will arise from each cell type, and the prognosis is different. The age group of each cell type is different, and the investigation will be different. Okay, we'll come to that in a minute. طيب. So very important slide to remember is this slide. You have to know that there is three cell lines, and each cell line, which kind of tumor is there. Okay. Right. So as I said before, there are functional ovarian cysts, there are neoplastic, which is benign, borderline, and malignant. What is the meaning of functional? Who can tell me what is the meaning of functional? Anyone? What is the meaning of functional? Hello, can you hear me?
ايوه دكتورة واضح.
طيب, so functional means that it is related to the function of your of her hormones اللي هي the hormone of estrogen and progesterone that comes in the cyclic way. But here the function is exaggerated, so it causes enlargement of the cyst. Okay, so it is known as functional. Does it need any treatment? No, because it is a part of her normal physiology. طيب. Neoplastic, هنا you need a treatment for that because it is not related to the hormonal changes. It is something abnormal. Okay, so this is the difference between functional and neoplastic ovarian cyst. Clear?
Yes, clear.
Right. So functional, what do you think? What kind of functional ovarian cyst she may have? أول شيء عندك follicular cyst. طبعا احنا عندنا ovulation each month, right? So follicular cyst arises when the ovulation is exaggerated and there is a big ovarian cyst, which is most likely a simple cyst, okay, that get enlarged. عادة الovulatory cyst تقريبا تكون مثلا 20 25 millimeter, but هنا في functional cyst it will be more than 3 centimeter, okay, 3 to 3.5 centimeter. هذه اسمها follicular cyst. طيب. So and then there is corpus luteal cyst. The corpus luteal cyst comes with what? What do you think? Where did you find corpus luteum? Where did you hear corpus luteum?
Rupture follicle. Rupture follicle after get ruptured, it will be called corpus luteum.
Corpus luteum comes with the pregnancy. Okay, this cyst is producing progesterone and it always comes with the pregnancy. Okay, تعرفوا انتوا في بداية الحمل the baby only gets his food from the progesterone, right? So from where the progesterone comes? From the corpus luteum. Okay, so this one is a pregnancy related. Now theca luteal cyst, it comes if there is an abnormal pregnancy, yani there is a very exaggerated hormones during pregnancy, like what? Like IVF pregnancy, like molar pregnancy. These are the things that comes with theca luteal cyst, okay, which is an exaggerated in the beta HCG. Okay, so the functional cyst is related to the ovarian function, like an ovulation, very commonly detected in a reproductive age. يعني مستحيل تلاقي functional cyst موجودة في postmenopause or in the premenarchal age. So it is a reproductive cyst and it arises because of the exaggerated in the ovulation. Okay, it can be reached up to 10 centimeter. يعني the size and the laterality is not a description of malignancy ولا benign. Okay, the benign tumor can come with any size. It can be very small, it can be very big. خلاص. Now here, what is the treatment? Nothing. You just repeat ultrasound after 6 weeks, and most of the time it will resolve spontaneously after the ovulation subsides. Okay, so I'll give you a scenario. Like there is 20 years old girl who came to you in the clinic with severe right lower abdominal pain. Okay, so what do you want to do for her? Hello? I need interaction, boys. And you have to interact. And you have to, even if it is wrong, it's fine. And you have to, we have to have two-way discussion. So if there is any patient who came to an ER 20 years old with left or right acute abdominal pain for 2 hours, let's say, in the ER, what do you want to do for her?
Ultrasound.
Good. So ultrasound. So what are you expecting here? What's your differential diagnosis? What is there in the right lower abdomen?
Could be appendicitis.
Okay, so it could be appendicitis. It could be what?
Ovarian torsion.
ممتاز. So it could be an ovarian cyst. Per se, an ovarian cyst, does it cause any pain? No, it doesn't cause pain. So you are expecting a torsion in the ovary. Good. What else you are expecting? مثلا ruptured ovarian cyst, right? So for that, you want to do ultrasound. Now, with ultrasound, you have to ask the ultrasonographer something extra, which is a Doppler ultrasound to see if there is any torsion of or not. Okay, so you did ultrasound, and during ultrasound, you find that there is right ovarian cyst, which is simple with a small septation, no papillary projection, and there is no torsion. Okay, so what you are expecting here, that she could be having two things. Either she could have ovulatory cyst, or she could have genuine adenoma, right? Because it is simple cyst, right? So either يكون عندها functional, or ممكن يكون عندها persistent ovarian adenoma. So how would you differentiate between the two? How would you differentiate between benign ovarian cyst adenoma or between the functional cyst? How would you differentiate between them?
ممكن الشيب يا دكتورة؟
لا.
size.
Not
ممكن
even the size.
بس
Benign
Yes.
ovarian cyst adenoma and functional cyst, they look the same. ما في أي تغيير في الفيتشر. Both of them, they are simple cysts with thin septation, and there is no ascites, and there is no complexity, يعني ما في solid component. Both of them, they look the same. طيب السايز حقها زي ما قلت لكم, السايز is not an indication for the type of tumor. فهمتوا كيف؟ السايز of it can happen in any size, big or small is not an indication. Unilateral, bilateral is not an indication for يا إما benign or malignancy. It's not an indication. There are some malignancy indicated or indications during ultrasound. Okay, I'll tell you that. But now, how would you differentiate between benign and benign cyst adenoma and between the functional cyst? You cannot differentiate, except if you repeat the ultrasound after 6 weeks, and you will find that a cyst is persistent. لأنه الfunctional cyst, it will resolve, right? إذا كانت cyst adenoma, it will be persistent. طيب? Clear?
تمام.
طيب. So هنا the first step you have to do ultrasound to exclude any torsion, to exclude any rupture. Okay? She came to you for the first time in the ER with ovarian cyst, which is about 5 centimeters تقريبا. Now the first step you have to do is to repeat the ultrasound after 6 weeks. If the cyst subsides, it is a functional cyst. If the cyst is still there, it is a benign cystic adenoma. Okay? Now, after you find that there is a benign cystic adenoma, you have to give her oral contraceptive for 3 months and then repeat the ultrasound again. If it subsides, well and good. If not, you have to do ovarian cystectomy. Okay? Clear?
Clear.
ممتاز. طيب ذكرتوا لي انه المريضة لازم نسوي لها ultrasound. Now, during ultrasound, you have to differentiate between benign and malignant ovarian tumor, right? So what are the features that will differentiate between the benign and the malignant ovarian tumors? There is some entity known as malignancy index. What is malignancy index? There is a scoring system that will differentiate between the benign and the malignant. The scoring system depends on the feature of the ovarian tumor. إذا كان عندك complex ovarian tumor, what is the meaning of complex? معناته solid and cystic component. هذا the first feature of the malignancy. The second thing is papillary projection. يعني داخل الأوفري يكون في papillae. هذه معناته إنه most likely it is malignant. Okay? The presence of ascites, the presence of thick septations. Okay? هذه كلها it will increase. It has some scoring, and if you have a high score, it means that the tumor is more likely to be malignant. Okay? Which is known as malignancy index. It's there in the next slide or in the upcoming slides. Okay, right. So we know about follicular cyst and how to evaluate a patient with ovarian follicular cyst and how to treat it, right? Corpus luteum cyst, it results from hemorrhage inside the corpus luteum. It produces what? Progesterone and estradiol and inhibin A. خلاص? And it comes during pregnancy. Fecal luteal cyst, it results from overstimulation of the ovary by beta SCG, which is common in normal pregnancy. It is not common in normal pregnancy. It is common in molar pregnancy, multiple gestation, or a reproductive technology. Okay. So this is a simple ovarian cyst, اللي هي known as follicular cyst. Okay. And this is a normal ovary. This one is a corpus luteal cyst, which is surrounded by a ring of blood vessels. يقولون لها بالالتراساوند يقولون لها fire ring. Okay, هذه تجي بالpregnancy. هنا الثيكال luteal cyst اللي هي حتلاقيها كذا cyst, which usually comes, it's more or less like follicular cyst, but it comes with reproductive technology ولا بتجي بسبب المولar pregnancy ولا multiple gestation. Okay. Now, benign ovarian cyst, احنا أخذنا اللي هو the first one, which is cyst adenoma. Okay. The cyst adenoma, it looks exactly the same as functional cyst. And how would you diagnose it? By repeating ultrasound. Can you hear me?
Yes.
Yes.
Yeah. So it comes after. After 6 weeks. If you repeat ultrasound and you find that there is a persistent ovarian cyst, then you expect that it is a benign ovarian cyst. Then after confirmation, you have to give her 3-month OCP, and then you have to repeat the ultrasound after 3 months. And if it is still persistent, then you have to do ovarian cystectomy. This is the treatment of benign ovarian tumor. Okay. Can benign ovarian tumor comes as a solid or not? Yes, it can come as a solid, genuine solid. يعني ما فيها cystic and solid component. لا, solid تماما. زي مين تتوقعوا؟ زي ايش تتوقعوا انه يكون solid؟ ايش في اليوترس solid؟ في شيء في اليوترس. Good, ممتاز. So the same concept. إذا كان solid component في الأوفري, most likely it is a fibroid or fibroid in the ovary. اسمها fibroma thecoma. Okay? Which is a benign ovarian solid tumor. Okay, we'll come to that in a minute. Right. So which is common, the benign or the malignant tumor? طبعا the benign tumor, right? It arises for about 80% of ovarian tumors. The benign tumor are solid or cystic. زي ما ذكرنا. الsolid اللي هي fibroma thecoma. الcystic اللي هي عندك اللهم صل على محمد عندك serous cystic adenoma or mucinous. كلها oma means benign, right?
So serous adenoma, which is the commonest type, which arises from the surface epithelium. It's usually variable in size. They may have a big size or small size. It could be unilocular or multilocular. It could be unilateral or bilateral. It could be طبعا هو السيرفيس حقتها very smooth and it is fluid filled يعني زي كذا. Okay, زي كذا. It's a very simple cyst with one lining. It could be multilocular. إيش معناته؟ معناته إنه two cysts جنب بعض. ممكن يصير. It could be a benign. Okay, and it is fluid filled. Clear? Mucinous cyst, as we said, it is. طبعا this is a very ugly looking tumor. It arises from the ovary and from the goblet cell of the ovary. And it is very ugly looking, mucinous, gelatinous, yellowish material, which is filled inside the ovary. And if you rupture it, the content of this ovary can be spread in the peritoneum, and which is known as pseudomyxoma peritonei. There will be a lot of yellowish gelatinous implants inside the peritoneal cavity. And in this stage, you may need chemotherapy to control it. Okay, usually this kind of tumor is very huge, very big. Okay, and very ugly looking. طيب. And if you spell it, you will be in big trouble. You will have pseudomyxoma peritonei, and then you will need chemotherapy for that. Okay, the treatment for this is definitely cystectomy without any delay. Okay, this is the mucinous cyst adenoma, a yellowish gelatinous material, and they tend to spread in the peritoneum. Okay, endometrioma or endometrioid tumors, which is known as chocolate cysts, very common in the endometriosis, right? This cyst is filled with hemosideриc or hemorrhage inside, or hemosiderin, like this. And you treat it according to the treatment of, the same treatment of endometriosis is the treatment of endometrioma or hemorrhagic cyst. Okay. طيب. dermoid cyst. انتوا اخذتوا الendometriosis, right?
Yes.
Right. So the treatment of chocolate cyst is the same treatment of endometriosis. خلاص? طيب. We are going to talk about the other entity, which is a germ cell line. The first one is, or the most commonest one is dermoid cyst, which is a mature cystic teratoma. Okay. Usually it comes with, it could be bilateral or unilateral, and it usually comes with a small cyst. Why it is small cyst and why it comes in early stage, or يكون البيشنت young. ليش تتوقعوا؟ ليش تتوقع أن المريضة تكون young؟ من وين جاي الدرمويد cyst؟ dermoid cyst عبارة عن cyst. It contains sebaceous gland, hair, teeth, and thyroid glands. So إيش تتوقعوا؟ جاية من وين هي؟ Which germ cell type؟ تلاحظوا إنه كل شيء موجود داخل الأوفري, right؟ موجود skin, موجود hair, موجود sebaceous gland, thyroid gland, teeth, كلها موجودة داخل الأوفري. So it arises from the endoderm, mesoderm, and ectoderm. Okay, it's always all the time benign. The malignant transformation is less than 0.5%. Okay, and when it is malignant, it is known as malignant teratoma or immature cystic teratoma. خلاص? So it arises, or usually the patient are young. Why? What do you think? From where كيف جت الإكتوديرم والميزوديرم والإندوديرم؟ متى حصل هذا الموضوع؟ فاهمين السؤال؟ ممتاز. So usually Patients will have this abnormality during her intrauterine life while she is developing. يصير في خلل في الديفلوبمنت وكل الجيرم سيل سيلز تكون موجودة داخل الأوفري، فعشان كذا يحصل عندها في السيلز في السيست يكون عندها sebaceous gland, hair, teeth and thyroid glands and etc. ممكن تلاقي lipids، ممكن تلاقي sebaceous gland and whatsoever. Okay, so usually that's why the presentation is early. عادة يكونوا حتى before 20 years يكون عندهم presentation، وتجي لما يكبر السيست ممكن يكون عندها pain and she may have symptoms. Otherwise usually it is diagnosed incidentally. تجي لسبب أو آخر يسوون incidentally ultrasound and it is found incidentally. Okay, unless it ruptures. When it ruptures it causes chemical peritonitis. ليه؟ لأنه there is a spillage of the chemical substance inside. Okay, this is the dermoid cyst and the diagnosis is during ultrasound evaluation. Very clear. يكون دائما يكتبون لك في الالتراساوند teeth or thyroid gland or يعني hair. It's very, very clear by ultrasound. Okay, طيب. So fibroma, remember I told you about the only single tumor that arises in the ovary, which is known as fibromathecoma. It is a firm and solid, and the feature here is that you will find water all over. يعني ممكن يكون عندك ascites, ممكن hydrothorax and ovarian fibroma. So what is the treatment here? What do you think? You should put her in chest tube مثلا or drain the acidic fluid.
No, surgical excision, I think.
ممتاز. So only by surgical excision the ascites will resolve and the hydrothorax will resolve. Okay, so you don't need to put her on chest tube or put her on or do acidic aspiration. Okay, so this is fibromathecoma. Now, clinical features. Here we have a real problem in clinical features. ليه؟ لأنه عادة البنات يجون without any symptoms. Most of the tumors are incidentally found. Okay, if she is lucky. Now, if she is not lucky, she will have a spread of the tumor. Why? لأنه symptoms is really vague. ممكن يجيها abdominal discomfort. ممكن يكون عندك الابdomen is increase in girth. هذه في late stages حتى. ممكن يكون عندها pressure symptoms like pressurizing the bladder or pressurizing the bowel. And also this is in the late stage when the tumor size is very big. Okay, acute abdomen will happen only if there is hemorrhage or rupture or torsion. Otherwise, you even may not have any abdominal pain. Okay. That's why, and unfortunately, there is no screening tool for ovarian tumor. So, clinical feature of benign ovarian tumor, we said before, right? اللي هي mobile, most of the time unilateral, but you may find it bilateral. Okay, mobile, no ascites, no cul-de-sac nodularity, and slow or no growth. So this is the feature of benign ovarian tumor. احنا نتذكروا قلنا لكم عن المالجنسي اندكس اذا كانت complex، اذا كانت fixed، اذا كان في thick septations، اذا كان عندك ascites، اذا كان cul-de-sac nodularity، اذا كان fast growing tumor. Okay, these are all العكس يكون features for malignancy. Okay.
Okay.
Now, how would you evaluate a patient? you have to do complete history and physical examination. طبعا in history you will find that vague abdominal pain or acute abdominal pain according to the symptoms and according to the cause, and you may have increased abdominal pain, you may have constitutional symptoms, كلها vague symptoms, right? And you need to exclude other abnormalities like GI abnormality or like يكون bladder abnormality and whatsoever during history, right? Physical examination, you may find an ovarian mass or you may not find an ovarian mass. Now, how would you describe an pelvic mass? Let's say that you find a mass in the pelvis. طيب, how would you describe it?
Where exactly?
Okay. ممتاز. So location, what else?
Size.
أحسنت. Size, what else?
Borders.
ممتاز. So surface, هل هو regular or irregular? What else? هذه fluctuation by physical examination. صحيح. What else?
Mobile or not.
Mobile, ممتاز. Mobile or fixed. Fixed to the underlying structure or overlying skin, right? When you palpate the skin over it, if it is fixed or underlying structure. إيش كمان?
Consistency.
Consistency. Is it firm ولا medium ولا solid? Good. إيش بعد?
هل في skin changes?
ممتاز. Skin changes above the tumor. إيش بعد? Pain. ممتاز. Discomfort and temperature. Okay? Discomfort when you move it or a temperature, right? So these are the features of any ovarian mass or any pelvic mass. طيب. So after doing physical examination, طبعا you have to do bimanual examination to exclude if there is any cul-de-sac nodularity. طبعا you will find it in the lateral fornix. تذكروا لما قلت لكم في محاضرة cervix انه if you go to the lateral fornix during pelvic exam to see if there is any nodularity. هنا if there is any nodularity, it means that there is metastasis. سواء كان مثلا endometriosis or endometriotic spots there, or if there is any malignancy that has spread to the peritoneum. Okay, you have to do an ultrasound, as I said before, that you have to look for malignancy index. Then for ovaries, an ovarian tumor, is it spreading through hematological spread ولا local spread? تذكروا وقت محاضرة الendometrium and the cervix كانت السبريد تقريبا local, right? في الأوفري السبريد هنا hematological. That's why it's better to do CT scan. ليش CT scan? Why CT scan? Why not MRI? What do you think? We said before, and an MRI will evaluate the soft tissue, right? A CT scan, it will evaluate the lymph nodes. So usually the ovarian tumors, they will metastasize to the lymph nodes. That's why CT scan is of more yield than the MRI. Okay? IVP, you can do it to exclude any uterine obstruction because of the mass effect, right? Then you have to exclude any metastasis to the colon or to the upper GI. So you have to do barium enema and colonoscopy. Then you have to obtain you have to do chest X-ray, and then you have to do your surgery, سواء laparoscopy or laparotomy, depending on your case. Okay? طبعا في indication for laparotomy, indication for laparoscopy. Now, this is an indication of surgery. Why we are doing surgery immediately? متى تسوي surgery immediately؟ تذكروا احنا لما قلنا أول مرة تجون أول مرة إذا جتكم بالovarian cyst, you have to exclude if it is benign or malignant, or sorry, if it is functional or benign, right? You have to repeat it after 6 weeks. If it's still persistent, معناته benign, and then you have to give her 3-month OCP and then do surgery. طيب إذا كانت عندك طبعا malignant immediately you have to do surgery صح؟ But إذا كانت عندك benign features you can wait for 3 months إلا في حالة واحدة اللي هي إيش؟ You have to do immediate surgery اللي هي إيش؟ أو حالتين. إذا جاتكم في الام سي كيوز مثلا حالتين من الحالات هذه على طول تختاروا سيرجري ما تعطوها او سي بي زي ايش؟ ذكرناها قبل شوي.
اللي هي كانت الفايبروما.
أحسنت. إذا كانت فايبروما there is no point to wait right because there is no يعني ال OCP it will not affect right so you have to remove it so إذا كانت solid lesions you have to remove it immediately. إيش بعد؟ من الأشياء اللي أخذناها قبل شوي إيش ممكن كمان؟ dermoid cyst صح؟ dermoid cyst cannot resolve with OCP لا you have to remove it immediately right so إذا كانت dermoid cyst you have to remove it إذا كان عندك solid lesions you have to remove it if there is any acute abdomen like you are suspecting rupture of the ovarian cyst or torsion of ovarian cyst you have to remove it okay if there is any features of malignancy like what like ascites like papillary projection in the ovary إذا كانت the size more than 5 centimeters زي ما قلنا followed by 6 to 8 weeks with OCP after OCP or immediately إذا كانت عندك 10 سنتيمتر okay at time of presentation هنا better to remove it immediately حتى لو كانت عندها benign features okay so if the mass is more than 10 centimeter remove it immediately ليه؟ لأنه ممكن يسبب pressure effect right palpable mass in the premenarchal or postmenopausal women لأنه the premenarchal and the postmenopausal women you should not have ovarian cyst right فاهمين indication of surgical removal
yes clear.
okay now malignant ovarian tumor هنا I will give you one information you have to categorize the patient into 2 groups the first group is below 35 سنة the other group is above 35 سنة why because أولا the origin of the cell is different the tumor marker that you will order is different prognosis is different and the surgical treatment is different here خلاص so the first thing you have to differentiate خلاص عرفنا ايش هي malignant يعني most likely malignant feature right so after that you have to categorize the patient according to the age before 35 and above 35 okay so طبعا زي ما قلنا احنا ovarian tumor they are the second most common tumor in the genital system most common cause of death in the genital or female reproductive system due to late diagnosis because of its vague symptoms okay and there is no screening tool خلاص so most of the tumor are epithelial in origin so epithelial tumor are commonest and alhamdulillah انه it comes in the late age يعني after 35 years of age okay the other types اللي هي germ cell tumor and the sex cord tumors are coming before 35 years are more common and before 35 خلاص so that's why the first difference between before and after اللي هو cell type after 35 يكون epithelial tumor is more before 35 يكون germ cell and sex cord tumor is more فاهمين clear
yes
لا.
clear. Yes.
clear ممتاز so 3% of the tumor occurs before 35 years of age and they are mostly non-epithelial in origin as germ cell tumor okay now the etiology there are certain theories about regarding the ovarian tumors. The first is ovulatory theory, because some of the tumor we found it that it is more common in nulliparous women, in the early menarchal woman, in the late menopausal woman, and oral contraceptive pills. What do you think? Is it will increase or reduces the risk? It reduces the risk. Why? Because it will suppress the ovulation. So إذا كل ما كان عندها الأوفيوليشن أكثر كل ما كانت معرضة للأوفيرين تيومر أكثر. معناته ال IVF is increasing the risk ولا decreasing the risk? It will increase the risk because it will fasten the ovulation and it will make exaggerated ovulation, right? So it will increase the risk of ovarian tumor. That's why you should instruct the patients not to take Clomid or clomiphene straight, without any medical advice, because it will increase her risk of ovarian tumor or ovarian cancer. Okay, and fertility treatment, it will increase the risk of ovarian tumor. Genetic factor اللي هي family history of breast, colorectal, and ovarian cancer per se, it will increase the risk of ovarian cancer. Okay. طيب. Now histological classification, as I said before, it depends on the age. صح؟ الابithelial tumor are more in the before 35 years, and اللي هو non-epithelial اللي هي germ cell ولا sex cord يكون before 35 years. طيب. Now in the epithelial tumors كلها نغيرها إلى carcinoma زي ما أنتم عارفين. serous cyst adenocarcinoma, mucinous cyst adenocarcinoma, endometrioid carcinoma, clear cell, Brenner tumor, undifferentiated. هذا كلها طبعا it's very well known, right? Germ cell tumor, we have dysgerminoma, endodermal sinus tumor, which is yolk sac tumor. We have embryonal cell tumor, choriocarcinoma, malignant teratoma, or mixed tumor, and metastatic tumors known as Krukenberg tumors. So any metastatic tumor سواء جاي من الcolon ولا جاي من البreast, which is known as Krukenberg tumor. Okay. Sex cord and the granulosa cell tumor, androblastoma or gynoandroblastoma. طبعا you don't need to remember all these names. It's very difficult to remember. أهم شيء أنتوا عارفين الepithelial tumor, you have to know it. Okay, because it's very easy صراحة. it's very easy. اللي هي cyst adenoma and mucinous and endometrioid adenocarcinoma, clear cell carcinoma, it's سهلة, right? Germ cell tumor, you have to كمان سهلة, choriocarcinoma, embryonal, endodermal sinus و dysgerminoma, and malignant teratoma كمان سهلة. الsex cord better اللي هي Sertoli Leydig cells, granulosa cell tumor. That's it. Okay, granulosa and Sertoli Leydig. Now, الابيثيليال tumors تذكروا لما قلنا لكم إنه في حاجة اسمها well differentiated tumor and عندك poorly differentiated tumor. طبعا both of them they have a difference in prognosis. Well differentiated عادة تجي من نفس الcell type حقت الأوفري, right? Poorly differentiated يكون different cell type from the ovary, like clear cell مثلا. So well differentiated epithelial tumor tend to be associated with early stage disease. There is no difference in survival between the different kinds of epithelial tumor. Serous cyst adenocarcinoma, the survival rate is the same as mucinous cyst adenocarcinoma, is the same as endometrioid adenocarcinoma. Okay? So all the survival rates among these epithelial tumors is the same. Clear?
Clear.
Like mucinous and endometrial lesions have better prognosis than serous cyst adenocarcinoma. Slightly better. Okay. طيب. طبعا serous cyst adenocarcinoma, they have complex in nature. إيش معنى complex؟ معناته they contain both solid and cystic component. They have papillary projections. They have stromal invasion. طبعا all the malignancies, they have stromal invasion, right? This is the feature of all the malignancy in all over the body. إذا كان عندك stromal invasion معناته it's malignant tumor. Now هنا the pathognomonic feature of the cystic serous cystadenoma is the samoma body اللي هي يقولون لها coffee ole spot اللي يكون زي الكوفي coffee bean يعني. Okay, and you may have طبعا glandular tissue, and the tumor should يعني زي ما قلت لكم إنه the size and the shape the size and the laterality is not a feature. You can have it big size, you can have a small size, you can have it in one ovary, you can have it in both ovary. Okay? Fine. So mucinous cyst, it accounts of only 10% of malignant ovarian cancer. Usually it is a multilocular and thin wall cyst containing mucinous glands. The same as mucinous cystadenoma. لكن لما تسوي لها test حتلاقي إنه في عندك cells of abnormal or atypical cells, حتلاقي goblet cells and mitotic loss of mitotic figures وأشياء زي كده. Now it is a very huge tumor. The cyst diameter may be of 25 centimeter. Okay, so it's very huge tumor. Usually it's more than 25 centimeter. So it causes tremendous pressure effect, okay, and heaviness. Endometrioid, it is associated with endometrial cancer, right? Endometrial carcinoma. Most of the time it is cystic and solid, and it contains turbid brownish fluid. طبعا the diagnosis is by cystectomy and frozen section. Clear cell, it's very less common. It's مرة uncommon. It's about less than 5%. It has clear cell and it has very poor prognosis, of course. Okay, it is associated with endometrioid or adenocarcinoma. Now borderline, what is the difference? What is the meaning of borderline? معناته إنه على الحفة زي ما تقول على حفة البناين وعلى حفة المalignant. معناته it's a line which is between the benign and between the malignant. It's not common. It's only about 10% of ovarian tumor, and they will show a varying degree of nuclear atypia. يعني معناته في عندها features of malignancy اللي هي atypical cells, and mitotic activity is increased, but there is no stromal invasion. تتذكروا لما قلت لكم إن المalignancy معناته stromal invasion. هنا borderline, it is the stromal invasion is not there. Okay, and the second feature is that it remains confined to the ovary. معناته for the treatment you don't need to remove the uterus, you don't need to remove the other ovary, you don't need to do aggressive surgery. Okay, usually كمان الpresentation هنا young patients. That's why this is another reason that you should not do you should not do extensive surgery. You just need to take the ovary اللي هي مع هنا في borderline. It's not enough to take the cyst only. هنا you have to take the ovary and part of the fallopian tube, and you have to take biopsy from the other ovary. Okay, so this is the treatment of borderline ovarian tumor. How would you diagnose it? You cannot diagnose it unless you do frozen section. تعرفوا أغلب العمليات حقت الأوفرين tumor, they open the patient and then they will inform or instruct the histopathologist that we are giving you a specimen. You have to evaluate the specimen while the patient is in the OR and while she's open. طيب. And within 45 minutes or 20 minutes, they will give you an answer if it is benign or malignant or borderline. Okay, if it is benign, then you need to close and that's it. Okay, if it is borderline, you have to take biopsy from the other ovary and then close. خلاص provided ان انت اخذت الاوفري and the fallopian tube. Okay, if it is malignant then you have to do يعني the whole surgery. We'll come to that in a minute. Okay, clear? واضح؟ عرفت الفرق ما بين benign, borderline and malignancy؟ واضح؟ في
Yes,
سؤال
please.
في سؤال إلى الآن؟ في أي سؤال إلى الآن؟
واضح دكتور.
طيب. Now, before doing staging, I told you that we are going to do physical examination and full history. We have to do investigation, and we listed the investigation that we are doing. We have one thing extra in the investigation that we need to do for a malignant. طيب كيف تعرف أنت malignant then benign؟ اللي هي by the ultrasound findings. Okay? إذا في ultrasound findings of malignancy, then you have to do tumor marker. Okay? This is known as يعني it's an extra investigation. Is it specific, the tumor marker? No, it's not specific, but it will give you an idea that there is high possibility of malignancy or not. طيب تتذكروا لما قلت لكم إنه المرضى لازم تقسموها إلى two categories اللي هي before 35 and above 35. طيب أول اختلاف قلنا before and after اللي هي cell type. After 35 عندك الepithelial cell tumor is more common. Before 35 a non-epithelial tumor is more common. Okay, now the second difference is the tumor marker. Now before 35, since it is epithelial tumor, معناته we have to order tumor marker that is suitable for epithelial tumor, right? Like what? ايش التيومر؟ قد اخذتوا تيومر ماركر في محاضرات سابقة؟ مش في الاوبي يعني في الميديسن ولا سيرجري ولا اخذتوا ولا ما اخذتوا تيومر ماركر؟
إلا قد أخذنا.
طيب ايش تتوقعوا تيومر ماركر حقت الاوفري above 35؟
CA 25.
ممتاز. So CA 125. Okay, so CA 125. So and for the breast ايش كانت؟ CA 19.9. Okay, and then we have CA 15.3, and then we have CEA. Okay, these are the 4 tumor markers that we need to order after 35. Now, CA 125 is important in epithelial tumor في any epithelial tumor. خلاص? So it's not specific for ovary. لا. It has يعني tremendous amount of differential diagnosis. So it is related to epithelial tumor. CA 19.9 قلنا للبreast. So there is correlation between breast and ovary, right? اللي ممكن يكون metastasis from the breast to the ovary and vice versa. Right? CEA is for lower GI or for colonic cancer. CA 15.3 حتكون للupper GI. Okay? For all these 4 tumor markers you have to order it. طيب إذا كانت below طبعا في سلايد مكتوب فيها هذه الأمور يعني لا تقلقوا موجودة كل المعلومات هذه موجودة. Before 35 you have to order another tumor marker which is اللي هي which is what? Which is alpha fetoprotein, okay, inhibin, LDH, and beta HCG. Okay. Okay, so and we will come to that, each tumor marker, what is the suitable origin of the cell type. Now, during staging, as we said before, ovarian tumor, is it surgical staging or clinical staging? ايش معنى كلمة staging؟
يعني to which extent ان التيومر وصل.
Okay, so here you want to know what is the extent of the tumor and what is the stage of the tumor, right? طيب, so this is staging. طيب إذا قلت لكم حاجة اسمها debulking surgery, what do you mean by debulking? معناته you are going to remove the bulk of the surgery. معناته you already staged her and the patient is having bulk of tumor and you are going to remove the bulk of the tumor. خلاص? This is a method of treating the ovarian tumor, right? So this one you have to differentiate between staging and between the debulking. خلاص? Staging, as we said, it is a clinical stage. It is a surgical stage. يعني إيش معنى surgical staging؟ يعني مثلا أعطيكم سيناريو. 50 years old postmenopausal lady presented to the clinic complaining of lower abdominal pain, abdominal distension for the last 3 months. By ultrasound, there is a complex ovarian cyst in the left side, about 5 or 7 by 5 centimeter with ascites. And there is a nodule in the left ovary مثلا, or there is صعبة شوي left ovary. There is a nodule in the lymph node, or there is a para-aortic lymph node enlargement by CT scan. Okay, so هنا إذا سألتكم what is the stage of this patient, إيش المفروض تجاوبوني؟
ما نقدر نعرف.
ممتاز. You cannot know by findings. You cannot know by ultrasound finding ولا CT scan finding. You have to do the surgery. Okay, so this is known as surgical staging. This is the meaning of surgical staging. Now, during surgical staging, what are you going to remove? ايش تتوقعوا ايش المفروض الاورجنز that we need to remove for staging؟ طبعا الان هي malignant, right? So you have to be very aggressive in treatment. So what are the organs that you need to remove? What do you think?
To confirm?
Now, first of all, if you are not sure of the diagnosis, you are right. You have to take مثلا عندك انت الان 7 by 5 centimeter ovarian complex cyst, and you are not sure if it is malignant or benign, right? So first of all, you are going to open her. طبعا you have to consent her for a complete staging, right? بعدين, when you open her, you have to remove the left ovary and tube, right? Or you want to remove the cyst. Either ways is correct. So if you want to remove the cyst, you have to take it to histopathology for what? For something known as frozen section. ايش هو frozen section? At the time of the surgery, same time of the surgery, histopathologists, they will do sections in the ovarian tumor, and then they will freeze it, and then they will evaluate it immediately. طيب, وبيعطوك جواب انه this patient has malignancy, or this patient has borderline, or this patient has benign tumor. Then you proceed with the surgery according to your diagnosis. هذه اسمها frozen section. Okay.
دكتور سؤال.
كيف؟
ايش فرقها عن الاونكولوجيكال ستيجنج؟ يعني الباثولوجيست ما يعملوا الستيجنج عن طريق
لا هنا انت اذا ما كنت متاكد ان هي benign ولا malignant. طيب, and you have an ovarian mass, right? You're not sure if it is benign or malignant, صح? Or borderline, you are not sure, right? So هنا you have to do frozen section for her. This is for diagnosis, histological diagnosis. خلاص? If you get a benign tumor, close the patient. You don't need to do any further surgery. If you have borderline, you have to remove the ovary and the fallopian tube, and you have to take a biopsy from the other ovary. This is the treatment for borderline. Now, for the malignancy, no, you have to do staging. What is the meaning of staging? As we said, you need to know what is the extent of the tumor. Where is the tumor itself? فهمتوا? What is the where it gets metastasized? فهمتوا كيف؟ هذا الفرق ما بين staging وما بين frozen section وما بين treatment. فاهمين؟ واضح؟
واضح.
طيب staging what you need to remove during staging. أول ما تفتح المريضة وتسوي أول ما تفتح أي مريضة with ovarian tumor سواء benign ولا malignant ولا borderline, you have to take cytology. أول ما تفتح المريضة شفت ascites تأخذ part of the ascites or certain amount of ascites, 10 cc of the acidic fluid, and send it for cytology for evaluation. طيب هذه أول حاجة تسويها. إذا ما لقيت ascites, you have to put normal saline and then drain fluid and then send it to the histopathology. This is the first thing you have to do before starting any kind of operation. طيب? Now, you did ovarian cystectomy and then it is malignant. Then you have to proceed with your staging surgery. What you have to do? You have to do, first of all, you have to remove the ovaries, fallopian tubes, and cervix, and uterus and upper vagina, which is known as total abdominal hysterectomy, bilateral salpingo-oophorectomy. Okay? So أولاً you have to remove the uterus, the ovary, the fallopian tube, the cervix, and the upper vagina. That is the first thing. The second thing, you have to take biopsy from 5 locations. First is paracolic gutter, pelvic, upper peritoneum, اللي هي upper GI, اللي هي upper abdomen, peritoneum, and supra or subdiaphragmatic, اللي هي below the diaphragm. Okay? So bilaterally, 2 from below the diaphragm, 2 from the upper peritoneum, 2 from the lower peritoneum, 2 from the pelvic area. هذه biopsies, small biopsies. Okay? That is the second thing in the staging process. The third thing is paracolic omentectomy. You know that the omentum is the guard of the abdomen. So whenever there is something abnormal, it will go to that area and guard it, right? That's why if there is malignancy, أول حاجة تصير omentum, it will go to the area which is abnormal and try to guard it. So you have to remove it so that it will not spread all over. Okay? So paracolic omentectomy. And then you have to do lymph node dissection. اللي هي توصل لين para-aortic lymph node dissection. تبدأ من pelvic إلى para-aortic lymph node dissection. Okay? So this is the staging process. The other thing is you have to do appendectomy in cases of mucinous cyst adenocarcinoma. Why? Because the origin of mucinous cyst غالبا تجي من appendix. So you have to remove the appendix. إذا كانت mucinous cyst adenocarcinoma. Clear? واضح الstaging؟ أول شيء حتاخد cytology، بعدين total abdominal hysterectomy, bilateral salpingo-oophorectomy. Then you have to do infracolic omentectomy. You have to do lymph node dissection, اللي هي pelvic lymph node, and the para-aortic lymph node dissection. And then you have to take the biopsy from the paracolic gutter, from the pelvic, from the upper abdomen, and from the below the diaphragm. Okay? So this is the staging. After the staging, after this extensive surgery, what will happen? After تقريبا 5 days, there will be a committee known as tumor board committee. What will happen in this tumor board? The oncologist will sit in this committee, the histopathologist, the radiation therapist, the oncology or medical oncology, they will all sit together, and then they will discuss the case thoroughly. They will evaluate the slides one by one, and they will stage the patient during this meeting. يعني تجيك الهيستوباثولوجيست تشوف الليمف نود، بتقول لك انه مثلا او بيقول لك انه في lymph node involvement. Then there is مثلا uterine involvement. Then there is peritoneal involvement. And accordingly, after you collect the whole data, you have to stage the patient. Okay? Now, I'll give you another scenario. Okay, and I want to know what you will do in this patient. Now, let's say that there is the same patient, 50 years old lady with postmenopause. She presented with lower abdominal pain, abdominal distension. By ultrasound, you find that there is a complex left ovarian mass, which is about 7 by 5 centimeter. And there is, by chest x-ray, you suspected a complex mass with ascites and papillary projection in ultrasound. You suspected most likely that this is malignant. Okay, so what you want to do, you have to order tumor markers, you have to do CT scan, you have to do IVP, you have to do colonoscopy, upper and GI endoscopies, and you have to do chest x-ray. Now, in the chest x-ray, there is a small nodule in the left lung. Now, what you have to do now? عرفتوا الحالة يا شباب؟ طيب, what you want to do now? What further investigation or what further treatment you want to do? Okay, you did that. You did the CT scan for all the في الجسم كله, and you find that there is a small nodule in the left lung. You have to do staging, صح? صح, you have to do staging or not? You don't know the stage of the patient, صح? طيب, how would you do the staging in this case?
Doctor, small nodule here, metastasis.
طيب, how would you confirm that this is metastasis?
Taking biopsy.
ممتاز. So here you have to take biopsy. Good. If it is malignant, then you already staged her as stage 4. فهمتوا? If it is benign, then you go for surgery. فهمتوا كيف?
And then, doctor, I look for other metastasis.
هي شوف, what is the aim of looking metastasis? الآن أنت عندك stage 4. الحين هي already stage 4 because there is lung nodule, right? So
Yes,
you staged her without surgery. أساساً you staged her as stage 4. Right?
Right.
ممتاز. So now you have to start treatment. Correct?
Yes.
Yes.
Chemotherapy.
Yeah, now the treatment is, we have 2 modalities of the treatment. The first modality is by giving chemotherapy and then doing the debulking surgery and then completing other courses of chemotherapy. Usually we give 6 courses of chemotherapy, okay? I'll come to that after we discuss staging. But I need you to know what is the difference between staging and between debulking, okay? So the first modality of treatment, as I said, endotoxic chemotherapy, and then do debulking surgery and then chemotherapy. This is known as interval debulking, okay? Right. There's another modality of treatment which is known as primary debulking. اللي هي انك تسوي debulking اول شيء بعدين تعطيها 6 cycles of chemotherapy. Now the studies showed that interval debulking is much more better than primary debulking in ways of أول شيء the complication is less. The chemotherapy tend to shrink the size of the tumor so that it will be easier for the surgeon to do the debulking. and the tolerance of the patient and complication is very much less in interval debulking. Okay? فاهمين؟ طيب. Now staging, it's very important. I will try to make it as simple as possible. Okay, just to try to concentrate with me, and you will go from this session remembering or memorizing this staging thing. Okay, so أول حاجة stage 1 growth limited to ovaries. طيب, remember this. Stage C دائما stage C معناته ascites. C معناته ascites. Okay. So stage 1 growth limited to ovary. Stage 1A 1 ovary. Okay, no ascites. The capsule is intact. Okay. Stage 1B 2 ovaries, no ascites, capsule is intact. Stage 1C معناته ascites. سواء كان عندك 1 ovary involved or both ovaries are involved. بس أهم شيء يكون عندك acidic fluid is positive with malignant cells. Or when you do surgery and you rupture her cyst, you will upgrade her staging from stage 1 to stage 1C. Okay, so try to remember that do not rupture the cyst during the surgery. Okay, so واضح, stage 1 limited to the ovary. Stage 1A 1 ovary. Stage 1B 2 ovaries. Stage 1C ascites, سواء كان عندك 1 ovary or 2 ovary. Or during surgery you ruptured the capsule, you will upgrade her or upstage her from 1A to 1C. Okay, clear?
Clear.
Right, stage 2 عندك عندك pelvic extension. طيب, there is a picture, very clear picture regarding stage 2. I will show you. It's very important to know it from the picture. Okay, so stage 2, it is a pelvic extension. What is the pelvic organs? We have uterus, we have bladder, we have rectum, and we have pelvis, pelvic peritoneum, right? So this is stage 2. Stage 3, and the peritoneal implants outside the pelvis. Okay, with positive lymph node or superficial liver metastasis. Okay, so stage 3, peritoneal implants outside the pelvis. يعني طلعت, it's a peritoneal implants. Okay, but it is not in the pelvic area. No, it is above the pelvic area. فاهمين؟ يعني مثلا مثلا intestinal involvement, مثلا عندك duodenal involvement, مثلا عندك peritoneum above the pelvis. Liver, there is a trick in the liver. Liver is divided into 2 parts. The first part is adjacent to the peritoneum, صح? The other part is inside the liver, which is the liver stroma. إذا كانت موجودة في superficial surface of the liver, it is part of the peritoneum, which is stage 3. إذا كانت الامبلانتس موجودة داخل الليفر, معناته it is stage 4. فاهمين؟ تجي كثير في الأسئلة, في أسئلة الMCQ هذه كثير تجي. إذا كانت الامبلانتس موجودة على surface of the liver, it is part of the peritoneum, so it is stage 3. إذا كانت موجودة داخل الستروما حقت الليفر, معناته it is distal metastasis and it is stage 4. Okay, so stage 4, distal metastasis like pleural effusion with positive malignant implants, liver involvement or deep liver, يعني deep liver involvement or lung involvement. Clear?
Clear.
طيب, في هنا هذا الصور. عندك stage 1A 1 ovary, stage 1B 2 ovary, stage 1C peritoneal implants with 1 or 2 ovary. Okay, stage 2A, it goes to the fallopian tubes. خلاص. Stage 2B راحت للcolon or the bladder. stage 2C اللي هي pelvic implantation هنا or positive ascites. Okay, هنا peritoneal implantation in the pelvic area or ascites. Clear? يعني stage 2A رايحة للفيميل organs اللي هي fallopian tube, uterus, cervix or vagina. Okay, هذه stage 2A. stage 2B رايحة للcolon or the bladder. stage 2C peritoneal implants in the pelvis or positive ascites. stage 3 طبعا زي ما قلنا احنا اللي هي lymph node involvement and the peritoneum above the pelvic peritoneum and surface liver involvement or involvement of the liver surface. Now, طبعا clinical examination, we said it before. يعني we don't need to remove it. يعني we don't need to repeat it. يعني by abdominal examination and investigations we already mentioned. طيب. Yeah. So regarding the tumor marker, I told you before that before 35 years of age, there are certain tumor markers that we have to order, like inhibin. We have to order it in granulosa cell tumor, beta HCG in choriocarcinoma, alpha fetoprotein in germ cell tumors. Okay, this is very important slide. Now, surgical surgery, we already done that. Okay, we discussed this. يعني هذا بيعطيك كل الفيتشر حق كل السيرجري that is done. يعني we discussed that. Okay, this is just an explanation. Debulking surgery, we have to give her chemotherapy. Now, the chemotherapy that we are using is the same. ما عندنا غير chemotherapy واحد اللي هي carboplatinum, cisplatinum, and Taxol. We have to give her every 3 weeks. And the طبعا ال complication, it happens or it starts after the 3rd week of giving the first dose of chemotherapy. Okay, this one interval debulking. يعني هو بيشرح لك interval debulking. This is all we discussed about. Okay. طبعا for stage 2 and 4 we have to start chemotherapy, carboplatinum and cisplatinum and Taxol every 3 to 4 weeks, and you have to give her for 6 cycles. Okay. طبعا the prognosis is different. Stage 1, 5-year survival rate is about 90%. Stage 3 and 4, it's about only 10%. Overall survival rate for any ovarian cancer is only 20% تقريبا. Okay. Non-epithelial tumor, the treatment is similar. طبعا أحيانا non-epithelial tumor, the only thing that we have here is that the patient are young and they usually want to preserve their fertility. Here you have to do for her as conservative treatment as we can because of the fertility issue. She wants to get pregnant, she wants to be a mom. So what we have to do, you have to remove one ovary and take a biopsy from the other ovary. If the biopsies from the other ovary is good, معناته you don't need to do an extensive surgery. If the other biopsy is positive, then you have to remove it. Okay? So start with conservative treatment in patients with non-epithelial malignancy. Okay? Rarely we use radiotherapy in patients with ovarian tumor, not like cervical and uterine. Cervical and uterine, we may use radiotherapy, but in ovarian tumor, we rarely use radiotherapy. Okay? Is there any questions?